Mucemanio-ini wa ataramu mwena wa rumuruti uria urabangitwo ni gikundi kia vsfsuisse niguo kwaririria bata wa mutaratara wa One Health niguo kugitira miturire ya andu, mahiu na maria maturigiciirie. Nimaugite makiria ma andu mbirioni 2 thiini wa thi nimanyititwo ni mirimu ya mahiu guku angi mirioni 2 gukua kumana na mirimu iyo. Mirimu ino ni ta rabies, anthrax, brucellosis, COVID-19, barin, TB na mirimu ingi.
The global level, for instance, an estimated 2 billion people are affected by zoonotic diseases, and the zoonotic diseases are very many, and these 2 billion people get affected, and of this another estimated 2 million people die from these diseases.
Dagitari wa mahiu Kadija Chepkoril niugite itanya riao ni kunyihia mirimu ya mahiu guku agitariria andu aria makuite kumana na mirimu iyo, imwe ario rabies kana kuguruka kwa.
Global level, annually we lose up to 59,000 people, and in Kenya we estimate a loss of 2,000 people annually. So when we look at our surveillance data in the last 3 years, for instance, we get about 100 cases of rabies being reported. Although there could be more because there's also the issues of underreporting.
Oho, niathite na mbere na gutariria mibango iria menayo na gikundi kia One Health approach ya uthaitiri wa mirimu ino.
The One Health approach is key in ensuring we optimize how each of the sectors work so that we are able to safeguard the health of the animals, the humans and the environment, because their health is interlinked, and therefore it is important that we have that collaboration, coordination and communication amongst the sectors. The zoonotic disease unit is at the national level, and as described in our strategic plan 2021 to 2025, one of our priority areas is decentralizing and strengthening the use of the One Health approach at the subnational level and the counties.
Professor George Gitau kuma University ya Nairobi sector-ini ya urigitani wa nyamu niugite mamwe ma maria mariirio mucemanio-ini ucio ni ati mirimu ya mahiu ni ya bata miturire-ini ya andu, mahiu na nyamu cia githaka.
During the deliberations, one of the things that was very clear and discussed is that zoonotic diseases are very important at the human livestock wildlife interface.
Gitau nioritie matura maria maikaraga muno na nyamu kwimenyerera muno na kuruta wira hakuhi na arugamiriri a mahiu undu ati mona ucenjia nyamu-ini icio makahura riboti kuri arugamiriri anene.
I would want to remind the communities that close to us in the pastoral communities to be very conscious about this and to always work closely with the veterinary authorities, and also those who are working in slaughterhouses to be very cautious about that. And if they notice any unusual signs, especially those whitish looking lumps, nodules within the lungs and so on, and other lymph nodes within the abdominal cavity, report to the high authorities so that the screening process of confirming or identifying the presence of this infection be established and be well documented for the safety and also for observing public health and human health.
Ngiribotera Muthingi TV, Getwo wa Geshi wa Wachira.